I'm going to go through a pelvic floor breathing relaxation technique to try to build awareness from what you're feeling from the inside in your pelvic floor muscles. This is for clients who have hypertonicity or overactivation of the pelvic floor muscles. So you're going to start on your back. Just get your head supported with a pillow. And ideally, you'd have your knees bent and feet just flat on the floor or table, whatever you're on. So it's going to start with breathing, belly breathing, diaphragm breathing, filling like we've done before. But I'm going to have you think about filling from the bottom up. So you're going to inhale through your nose and you're bringing the air into your abdominals. You're allowing them to expand. You're allowing the breath to move your rib cage out to the sides and expand. And then just to not be restrictive, you can let your chest rise a little. You just don't want it to feel like you're only breathing in your chest. Okay? Now, as you're thinking about bringing the air in, you're going to think about bringing the air all the way down to the vaginal opening, to your sits bones. Okay? And if you can just think about muscles in that area, in around by the vulva or in the vaginal canal and around the vaginal canal, if you can try to think about softening that area. You know, sometimes people use images of like if there was a flower that was closed, all the petals were closed. When you inhale and you're trying to bring air down to that region, you're trying to let the petals just open and release. Okay, I know it feels like such an abstract thing, but connecting your brain to some of your muscles through imagery is very powerful to create this relaxation response. And you want to just try to stick with this breathing pattern for a few minutes if you could, okay? And just see what you learn, see what you feel. Try not to force anything. So I'm going to just walk you through it because me just demonstrating it for you is really not going to offer you much. So I'm going to have you just lay down on your back and you're just going to listen to my voice as you go through this. And just let your head be heavy down into the table. Let your legs be heavy. Go ahead and just let your arms feel supported and relaxed. If you're cold, I definitely recommend putting a blanket over yourself because when you're cold, we tend to tighten up. So you want to feel pretty cozy while you're doing this. So you're going to inhale through your nose and imagine the air is going all the way down, filling your belly, all the way down to where the vulva and vaginal opening are, and all the way down to your sits bones in a way that it's almost letting them spread apart and let go and open. And then when you exhale, it should feel like a very passive exhale. You're not working to get the air out, you're just letting the air come out. So it's like very soft. It's not very forceful. You're not trying to contract your abdominals. So again, inhale, fill your belly, bring air all the way down to the pelvic region, vaginal opening, vulva, sits bones spreading and opening out to the sides. When you're ready to exhale, very passively and slowly and quietly, just let the air out and feel your head, pelvis, feet, everything just sink down into the floor or table. So again, inhaling through your nose, filling the belly, expanding the rib cage, letting air fill all the spaces in the body, particularly focused on bringing the air low down as far as you can into your pelvis. Exhale and slowly and quietly let the air out as you feel your body sink down into the table. Arms get heavy. Let the hands and rotation, let them fall wherever they want to. You don't want to feel like you're holding anything in place. You're just letting everything go. Now, if you can also put your feet together and support yourself. I'm going to steal this pillow from myself, but support yourself with a good amount of pillow. I'm just going to show you on this outside leg to support you in this more open position. But you don't want to feel like it's open and there's a big stretch happening. You just want to feel like you can give your legs to something, that you're not holding them up with your muscles, that you are just letting those legs be open and supported by something, and you're gradually, again, just giving your body down. You can have your arms up. If you're someone that you feel like you really arch your back, perhaps that's not the most restful position. You can have your arms on your belly. Sometimes palms up feels good, palms down, or even just kind of open. But again, you want to feel like you can let go and be supported. Use props. You want to really spend some time, maybe 3 to 5 minutes, just going through this repetitive sequence of bringing air down into the pelvis, widening and opening things up, giving this relaxation response, and then exhaling very passively without force and sinking, melting down into the surface.